Imagine you're sitting in your doctor's office, feeling perfectly healthy, when your physician recommends a test. Just routine, they say, just to be safe. You nod and agree because more information must be better, right? But on the drive home, a question nags at you. Will this test actually help me, or could it lead somewhere I don't want to go? I'm Dr. Naira Stein, and I've practiced medicine for over 2 decades. What I've learned is that medical testing is a powerful tool. When used appropriately, it saves lives and prevents serious disease. But I've also watched perfectly healthy people go through months of anxiety and unnecessary procedures because of tests that seemed reasonable at the time but weren't actually needed. Today, I want to help you understand when medical tests genuinely serve your health and when they might create more problems than they solve, particularly as you get older. Not to make you afraid of testing, but to help you become an informed participant in decisions about your own care. Stay with me, because what you learn here could help you make choices that truly support your well-being. Before we talk about specific tests, I need you to understand something called the cascade effect. This is what happens when one test leads to another, then another, and suddenly you're caught in a medical whirlwind that's hard to stop. Here's how it typically unfolds. You go in for a screening test while feeling perfectly fine. The test shows something, maybe a spot, a shadow, a number that's slightly off. That finding might be completely harmless, something that would never cause problems. But once it's found, it needs follow-up. Your doctor sends you to a specialist. The specialist orders more detailed testing. Maybe that shows the same thing, still unclear. So now you're talking about a biopsy or procedure. Each step carries risks: infection, bleeding, complications, anxiety, lost time. And here's what often happens at the end. You discover it was nothing, something that would never have threatened your health. But you've been through months of worry and medical procedures, and you're actually worse off than when you started. Understanding this cascade helps you make better decisions about which tests genuinely help and which might start a process you'd rather avoid. Let me walk you through several types of testing where this conversation becomes especially important as we age. First, let's talk about whole body imaging scans, full body MRIs or CT scans that promise to check everything at once. You've probably seen advertisements offering these comprehensive scans to catch problems early. The idea sounds appealing. Get a complete picture of what's happening inside your body. Here's what actually happens. When you scan healthy people over 60, you find something unusual in almost everyone. Small lung nodules, kidney cysts, liver spots. Medical professionals call these incidental findings, things discovered by chance. The vast majority will never cause problems. They're just part of having a body that's been around for 6 or 7 decades. But once found, these things can't be ignored. The report will recommend follow-up imaging. Now you're getting scans every few months, watching something that likely would never hurt you. Maybe it leads to a specialist visit. Maybe a biopsy. Each step has risks and costs, financial, physical, and emotional. Research on whole body screening shows that people who get these scans don't live longer than people who don't. They don't avoid more diseases, but they do experience significantly higher rates of anxiety and undergo more procedures. The scans create problems rather than preventing them. What should you focus on instead? Functional health measures that actually predict well-being. Can you walk up 2 flights of stairs without getting winded? Can you get up from a chair without using your hands? How's your balance, your sleep, your energy? These tell us far more about your health than any scan. If you want a real health assessment, spend time with a doctor who will review every medication you're taking, discuss your diet and activity level, and talk about your social connections. These everyday factors determine your health far more than pictures of your insides. Next, let's discuss brain MRIs for minor memory concerns. Here's a common scenario. Maybe you're in your mid-70s and sometimes you can't remember an actor's name, or you walk into a room and forget why. Normal things that happen to everyone as they age. But your family worries about Alzheimer's and encourages you to get a brain scan. I understand that fear completely. Nobody wants to think about losing their memory. But here's what you need to know. Getting a brain MRI for mild forgetfulness is rarely helpful and often creates anxiety. When you get the MRI, the report will likely mention things like mild cerebral atrophy, age-related changes, white matter lesions, small vessel disease. These terms sound frightening, like your brain is deteriorating, but here's the truth. Those findings are completely normal for someone in their 70s. It's what every brain looks like at that age, like scanning skin and finding wrinkles. The problem is, the medical terminology doesn't sound normal. It sounds like disease. Suddenly you're thinking about brain damage and dementia, even though you're functioning perfectly well. Studies show that when we scan healthy people over 75, more than 90% have findings that look abnormal on paper, but most have perfectly normal memory and thinking. What works better? Simple cognitive tests done right in the office, remembering 3 words, drawing a clock, counting backwards. These actually measure how your brain functions, not just how it looks. And if those tests show concerns, we look for reversible causes. Medications that cause fogginess, low vitamin B12, depression, sleep apnea, thyroid problems. These are often fixable without any imaging. Now, if someone is getting progressively worse, getting lost in familiar places, unable to manage finances, that's different. Then, comprehensive evaluation, including imaging, makes sense. But for everyday forgetfulness that comes with age, an MRI often creates more worry than clarity. Let's talk about cardiac stress testing, specifically putting someone on a treadmill just because they've reached a certain age. This often happens before routine surgery. Maybe you're 72 and scheduled for knee replacement, and hospital protocol requires a stress test for everyone over 70. But think about this. If you can walk 2 miles in daily life without chest pain or shortness of breath, what will the treadmill tell us that we don't already know? Your daily life is your stress test, and you're passing it every day. Here's the problem. Stress tests have high rates of false positives in older adults. The test suggests something is wrong when nothing actually is. This can be due to medications, how heart rate responds with age, or many other factors unrelated to dangerous blockages. Once the test comes back abnormal, you're scheduled for cardiac catheterization, threading a tube through an artery to your heart. It's invasive with real risks. Often doctors find exactly what you'd expect in a 72-year-old heart, some plaque buildup, some narrowing, but nothing requiring stents or surgery, nothing about to cause a heart attack. But now you've undergone an invasive procedure and been labeled a heart patient. You're on new medications. Psychologically, the damage is done. Maybe you were playing tennis before, but now you're afraid to exert yourself. What's the alternative? Listen to your body. That's the best stress test. If you can climb stairs, walk at a good pace, do normal activities without chest pain or unusual shortness of breath, your heart is telling you it's functioning well. Watch for actual symptoms: chest discomfort with exertion, unusual breathlessness, dizziness. Those warrant evaluation. If you want to assess future risk, there's a better tool: the coronary calcium score, a quick CT scan that measures hardened cholesterol in your arteries. It guides prevention decisions, diet, exercise, possibly medication, without automatically triggering invasive procedures. It gives information for choices, not anxiety that forces procedures. Finally, let's discuss colonoscopy screening after 75. Let me be clear, colonoscopies are valuable. I recommend them starting at 45 or 50. They prevent colon cancer by removing polyps before they become dangerous. If you're in your 50s, 60s, or early 70s and due for one, please get it. But every medical test involves balancing benefits and risks, and that balance changes with age. The benefit of colonoscopy is preventing cancer that takes 5 to 10 years to develop into a problem. If you're 78 or 80, is that benefit worth the risks? Colonoscopies carry risks that increase with age. The preparation can leave older people dehydrated and weak. Sedation carries more risk of confusion or breathing issues. And there's perforation, a tear in the colon wall, which roughly doubles or triples in likelihood after 75. A perforation means emergency surgery, sometimes resulting in a colostomy bag. For an 80-year-old, that kind of operation can end independent living. Weigh that against preventing cancer that would take years to become dangerous. If life expectancy is less than 10 years, you're statistically more likely to be harmed by the colonoscopy than helped by it. That's why most medical guidelines recommend stopping routine screening somewhere between 75 and 85. This isn't one size fits all. If you have family history of colon cancer, previous polyps, or inflammatory bowel disease, that changes the equation. But for average risk individuals, continuing colonoscopies every 5 or 10 years into your 80s likely causes more harm than benefit. What should you do instead? Shift from invasive screening to smart awareness. Pay attention to symptoms, persistent changes in bowel habits, blood in stool, unexplained abdominal pain or weight loss, developing anemia. These warrant immediate evaluation regardless of age, and focus on diet. Eating fiber through fruits, vegetables, beans, and whole grains protects your colon naturally without any risk. So there you have it, several types of testing where thoughtful conversation matters. Whole body scans that find problems that aren't problems, brain MRIs for normal forgetfulness that create abnormal anxiety, routine stress tests that trigger procedure cascades, and colonoscopies after 75 that may risk more than they prevent. Notice the pattern? It's about the cascade, one test leading to another, to a procedure, to complications. Somewhere along the way, we forget to ask the most important question. Is this person actually better off? Here's what I've learned in my years of practice. Health isn't about perfect test results. Health is about function, being able to do what you want to do, enjoying family, taking walks, reading, living without fear, and without unnecessary medical interference. The goal at 65 or 70 or 80 isn't just living longer, it's living better with independence, dignity, and joy. Sometimes the best way to protect that is saying no to a test that would send you down a path you don't need to travel. I'm not saying avoid all medical care. I'm saying be an informed participant. When a doctor recommends a test, ask why. Ask what happens if it finds something. Ask about the risks. Ask if there are alternatives. Then make a decision based on what matters to you. Here are questions that help guide these conversations. What exactly are we looking for with this test? How likely is it to find something that would genuinely threaten my health in the next 5 to 10 years? What are the risks of the test itself and any procedures it might lead to? If we find something, what would treatment involve and how would it affect my quality of life? What happens if we don't do this test? Would we simply watch and wait, or are there symptoms I should monitor? These aren't confrontational questions. They're collaborative ones that help you and your doctor make decisions together, weighing your individual circumstances, values, and priorities. Remember that good doctors welcome these conversations. They want you informed and engaged. They understand medicine isn't one size fits all, especially for older adults. If your doctor becomes defensive when you ask thoughtful questions, that itself tells you something important. You have the right to understand why tests are recommended, what alternatives exist, and what risks and benefits look like for someone your age with your health status. You have the right to make informed decisions about your own body, even if those decisions differ from standard protocols. Also remember that staying healthy isn't just about which tests you do or don't get. It's about the fundamental things: staying physically active in ways you enjoy, eating well, maintaining social connections, managing known conditions with appropriate treatment, getting good sleep, and finding purpose in your daily life. These aren't exciting or high-tech, but they're what actually determines healthy aging. They improve both quality and length of life far more than aggressive testing ever could. You're in charge of your health, not protocols, not computer reminders, not guidelines. You. And the more you understand about what you're agreeing to, the better decisions you can make. Medical testing is a tool, and like any tool, it works best when used thoughtfully, for the right reasons, at the right times. Trust yourself to ask questions. Trust your instinct when something doesn't feel right. And trust that being informed and engaged in your care is one of the most important things you can do for your health. Take care of yourself, and remember, you deserve medical care that genuinely serves your well-being.